The effect of foot exercises on wound healing in type 2 diabetic patients with a foot ulcer, a randomized controlled study. The purpose of this study is to investigate the effect of foot exercises on wound healing in type 2 diabetic patients with foot ulcers. Did you know there is a 12% to 25% risk for patients with diabetes mellitus to develop diabetic foot ulcers during their lifetime? And diabetic foot ulcers constitutes 40% to 60% of non-traumatic amputations. Also, when a diabetic foot ulcer occurs once, the rate of possible reoccurrence within 3 years is 35 to 40%, and within 5 years, it's 70%. There are many studies that have emphasized the importance of performing daily foot exercises for patients with diabetes mellitus. Most studies of foot exercises examine the effects of foot exercises on patients with diabetes mellitus who do not have diabetic foot ulcers. These studies have reported that diabetic foot exercises have positive effects on neuropathy, vasculopathy, standing and walking characteristics, body balance, foot pressure, and foot muscular force. It is recommended that patients with diabetes do regular foot exercises to increase blood flow to the lower extremities and to promote joint mobility. Other than some small studies, the effect of exercise on wound healing in patients with diabetic foot ulcers is limited. Foot exercises in patients with diabetic foot ulcers may facilitate movement in joints and muscles, increase blood flow to the area, and provide adequate wound perfusion. These exercises may accelerate wound healing, prevent amputations, increase quality of life, and reduce cost. The design used for this research study was prospective randomized control study. Now, let's take a look at the methods they used. The study identified 65 patients between the ages of 20 and 80 years old from an outpatient clinic with a Wagner grade 1 or 2 diabetic foot ulcer. These patients were recruited by researchers in the clinic where they received treatment. The study subjects were randomly assigned to a control group or an intervention group. The intervention group received standard wound care and performed daily foot exercises for 12 weeks. The control group received standard wound care but no exercises. Data was collected by using investigator-developed forms, patient information forms, and the diabetic foot exercises log. The ulcers in both groups were examined and measured at the 4th, 8th, and 12th weeks. The groups were compared in terms of ulcer size and depth. To analyze and compare the data, frequency distribution, mean, variance analysis, and the independent samples t-test and the x-squared test were used. Only 60 patients completed the study and were included in the final analysis. Subjects were followed up between February 2014 and June 2015. Ethics and consent. To initiate the study, an approval with the decision number 11.12.2013 was obtained from the Scientific Ethics Committee of the Faculty of Nursing at Ataturk University. Researchers obtained a written permission from the 2 hospitals where the study was conducted, and written and verbal informed consent was obtained from each participant. Now for the results of this study. Significant differences were found between the study's intervention group, mean ulcer size, and mean ulcer size in the 4th, 8th, and 12th week, and between the mean ulcer sizes in the 4th and 12th weeks. Also, a significant difference was found between the control group's initial mean diabetic foot ulcer area and the mean diabetic foot ulcer area in the 12th week. Intragroup comparison shows that in the study intervention group, while the mean ulcer area significantly decreased in all three follow-ups compared to the baseline findings, in the control group, the mean decreased only in the last follow-up. A significant difference was found between the study intervention and control groups, beginning mean diabetic foot ulcer area and the mean diabetic foot ulcer areas in the 4th, 8th, and 12th weeks. This study also determined a statistically significant difference in terms of the diabetic foot ulcer sizes between the baseline and first, second, and third follow-up findings of patients performing exercises for 61 to 90 days. At the end of this study, 20% of the study intervention group, while only 3% of the control group patients made a full recovery. Application to practice. This study's findings suggest that foot exercises influence wound healing in diabetic patients and should be considered as part of the treatment plan. Diabetic foot exercises do not require equipment, can be done anywhere, and does not increase cost. The researchers recommended that foot exercises should take a more prominent place in diabetic foot education and routinely incorporated into the diabetic foot ulcer wound treatment plan. Of course, additional research is needed to confirm these findings.